I'm Johnny Wood. I'm an orthopedic PA from Richmond, Virginia, practicing in Fredericksburg.
Learn a lot.
I learned quite a bit. I was really impressed to see the anatomy on the big screen, and being able to watch your needle and the placement of what you're injecting, I think makes a really big difference.
When you got the hands-on experience, do you feel like it's something that'll help you a lot next week, next month?
Yeah, I mean, it's definitely going to take a lot of practice to get good at it. But I think it was very helpful to be able to get in and practice with not only each other but with some live patients. And yeah, I look forward to getting proficient.
Full course to take. Is this something that you would recommend to others?
Oh yeah, and I think it's going to be more and more important as we get into doing more PRP and more regenerative medicine and getting away from the old just cover everything with steroid. So I do think it's going to be very important to have courses like this.
Did you have a procedure yourself?
I did. They injected an external MCL injection, and then they did an intra-articular knee injection.
So this could help you with the skill set, but also being able to tell your patients about
Yeah.